Obsessive thoughts. So someone made a comment here. There it is. Anything on obsessive thoughts, please. So I don't know exactly what it is that you're referring to, what's going on, but I'll tell you a little bit about, obsessive thoughts. So there is a condition called obsessive compulsive disorder. Just because you have obsessive thoughts does not mean that you have obsessive compulsive disorder. If you're worried about it, you can go see your, a primary care doctor or a psychologist, a therapist, or a psychiatrist. But if you find that you're having these very intrusive thoughts that you can't get rid of and they're really disturbing to you, if you think you might have obsessive compulsive disorder and you want to do what you can to get it treated, there are medications available if you see your psychiatrist. But honestly, my favorite thing to do with obsessive compulsive disorder is taught by a doctor by the name of Jeffrey Schwartz. This is the book that I recommend. It's called Brain Lock, Free Yourself from Obsessive Compulsive Behavior. Now, if it's nothing that extreme, if you're just having thoughts that are in your head that you just can't get rid of, like anxiety-provoking thoughts or depressive thoughts, that's a completely different thing. And here's what I'll say about that, okay? So I think of thoughts a little bit like a river, okay? It's very difficult to stop a river from flowing. If you go and stand in the middle of a river and you're like, stop, and you're trying to hold back the water, not gonna happen. And the same thing happens when you try to stop thoughts. Stopping thoughts doesn't work, but redirecting them can be very effective. So imagine this instead. You're not trying to stand in the middle of the river to stop it. What you're doing is you go and you dig another canal. And there's a couple techniques that I use for this. One technique is replacing the thought with a desirable thought. This isn't stopping the thought. This is just replacing it, redirecting the flow of the water. So if I have a really negative thought in my head about something, or really anxiety-provoking thought, or a depressing thought, I will start consciously trying to focus on positive things. I direct my patients to do this. Make a list of positive things in your life and then recite them over and over and over again, like a mantra. It's boring sometimes, but it's better than obsessing over these horrible thoughts. Now your mind will want to go right back to the awful things. That's natural. You have to keep doing the other thoughts until you dig a deep enough riverbed for the water to naturally flow there. It has to become a habit. So try to make the thought something interesting or compelling if you can. The other technique that I use to get control of thoughts is called meditation. And I have a technique for meditation that I use. I've covered it in other videos. You can scroll down and see the videos where I talk about my meditation techniques. I do that almost daily, and it's very beneficial. There's actually some good research to back meditation and mindfulness. And anyway, hope this is helpful for you. Thank you for the question.